Hello, and welcome to another installment of Spotlight on Special Needs, a podcast series from Kennedy Krieger Institute. Today, we're talking to Dr. Stacy Suskauer, co-director of the Kennedy Krieger Institute's Limb Differences Clinic. Thank you for joining us, Dr. Suskauer. Can you tell us more about the patients that you see at the clinic?
Yeah, lots of the kids are born with some limb difference. We follow them over time. Some of the kids come to us needing surgical recommendations for long-term management. Others come and they wouldn't have any surgery, but they're looking for therapy options and prosthetic options, and we help with that. We have other kids who have acquired amputations, so they weren't born with them, but they have them either because of illness. So one relatively common cause is children with just widespread infection. Meningococcemia is sort of a famous one, but it doesn't have to be that bacteria. And children wind up losing their limbs because there just isn't good circulation to the limbs while you're fighting that serious of an illness. We have children with that kind of amputation. We have children who have had cancer, bone cancer, and needed an amputation because of that. And also children who had some kind of trauma, with lawnmower injury being the most common cause of trauma-related amputation in kids.
What services does the clinic provide for these children and their families?
A lot of parents are really just looking for, how do I help my child do everything they want to do and be as normal as possible. For a number of children, we're looking at prosthetic options and trying to really optimize the prosthetics fit. Sometimes children have different levels of amputations than adults would have. A lot of adult amputations happen because of vascular disease and poor healing, so you usually don't have good enough circulation to do an amputation of just the foot or part of the foot. But we do see that in children, and sometimes it presents some extra difficulty in getting a really good prosthetic fit. So we certainly address questions like that. We address the children who are born with lower leg deficiencies. Oftentimes, they might still have a foot and a lower leg, but not the entire leg. And then often there's the question of what's the best way to use the leg? Is this a child who would benefit from a surgery to try to lengthen the leg? Is this a child who would be better served by an amputation and fitting with a prosthesis? We start seeing the children soon after birth, actually, within the first few months of life. Sometimes parents are just, looking for some more information to sort of prepare themselves for thinking ahead, but young children with an upper extremity deficiency, our goal is actually to have a prosthesis on them at about the time that they're starting to sit, about 6 months of age. And it takes some time to fit it and get insurance to improve it, so we like to move early. For the lower extremity deficiencies, it's usually by the time they pull to stand, so maybe closer to 9 months that we really want to have them in a prosthesis. And in terms of how long we follow them, I guess we're still new enough that we haven't sent anybody off to college yet, but throughout childhood and I would say into young adulthood.
How frequently are children usually seen at the clinic?
Right now our clinic is every 2 months, and we have several children who we see several times a year. It depends on multiple different factors. One is the kind of limb difference that the child has, where they are in development. So younger children are going to be changing much more rapidly than older children. So all kids, they're constantly changing. They're growing. They often need really frequent sort of tweaks to their prostheses. Kids even need, whole new prostheses more than adults do just because they're making such rapid changes in function and size. And it's possible that when a child gets to their teenage years, they're going to be pretty happy in the prosthesis that they're using and really just sort of monitoring over time.
I know that your clinic takes a unique approach to medical care. Tell us more about the different specialists that work together as a team to provide treatment for your patients.
Sure. That's what we think sets us aside from other clinics in the region, is that we have sort of one-stop shopping. So I'm a rehabilitation physician, and really the goal of my specialty is to improve a child's function. So when I see the child, I am looking at their limb, I'm thinking about their prosthesis, and also just their overall function. So if they come in with an arm difference, we're certainly going to think about how they're able to use their arm, how they're able to do the things we call activities of daily living, like dressing and eating and bathing. But I'm also going to take an overall approach to the child and be concerned with how they're succeeding in school. If there's any other, they may have pain in their leg because they're overcompensating for a difference in their arm or something like that. We also have the orthopedic surgeon who looks at things from a slightly different standpoint, but has a lot of the common goals also. Their input is really important in terms of thinking about surgical management of the limb, whether that's something to think about revising the limb before it could be fit into a prosthesis and the timing and options for that, or whether it would be some sort of lengthening procedure. And then again, following over time, especially for those children who are going to need revisions, basically to optimize their function over time. And he's also going to be very helpful. We have children who have overuse injuries and looking at those from the orthopedic perspective. The physical therapists, their real goals are thinking about walking in this population and other gross motor skills. So they'll often get involved early on when we're looking at young children who have limb differences in terms of thinking about how we can facilitate for their development to be as normal as possible. And a lot of times that's just sort of creative play, encouraging children to do certain movements. They also help us in clinic to evaluate what a child's therapy needs are over time. And some of the children come to Kennedy Krieger for ongoing therapy, and others get therapy closer to home. And our physical therapist is a nice link with the home physical therapist about any challenges the child is having in physical therapy or any additional suggestions we have for thinking about how to optimize their overall function. The same is sort of true of the occupational therapist, except their focus is really the upper extremity. They're looking more closely at the children with upper extremity differences, but also thinking about, again, how to optimize any child's overall function. And then the last member of the team is the prosthetist, who is really an expert in the prostheses. So we have a team that's really wonderful. They help us troubleshoot when a child comes in and they're having pain in their prosthesis or they're not happy with their gait. It's really helpful to have everybody's input about what the different factors may be. And again, some of the children see the prosthetists we have in clinic for ongoing adjustments and prostheses. Sometimes our prosthetist needs to call their prosthetist and say, this is what we were thinking. We'd love to see a certain change in the design or that maybe this would help. So if we weren't all together, what would happen is the child would probably go to their orthopedist who would say, well, maybe you need to see your prosthetist and see if it's a problem with the leg. And the prosthetist would say, well, maybe I could change this, but I'm also thinking about, is the strength in the leg really great, or is there something we could do differently? And so you not only get sort of everybody's input, but you also just have a lot of opportunity we do to bounce ideas off of each other and to come up with a cohesive plan. So it's not really the family's job then to take suggestions from one person to another and be the middleman, but we get to sort it all out there and help the child.
I understand that in addition to helping children with their physical challenges, you also help address their emotional needs.
Yeah, we think that's a really great part of the clinic. Limb differences are not terribly uncommon, but they're uncommon enough that a lot of children with a limb difference or families with a child with limb differences have never met somebody else in the same situation. We're very focused on the child's sort of physical function, but we also really try, as we're seeing them, to address some of the emotional issues or social issues that come up at different points in childhood in terms of how do you explain this to little kids? What do you do when the child enters school? How do you get their peers ready? Sometimes it's siblings. When you have a baby, it's really the sibling that's fielding the questions. So one of the things that we think is really wonderful is for these children to understand that they're not alone and they're not the only one who faces these challenges. And that's another reason why we group all these patients together on one afternoon, is that naturally in the 801 building, there's a beautiful playroom on the first floor. They're going to wind up playing together. They'll see each other in the hallway. And, we don't force it on anybody, but we usually offer to the families, we have a child next door with a similar situation. Would you like to meet them? We also do our best to let parents know about all the educational materials that there are. So we actually have some dolls that have limb differences. And there's a set of dolls that also comes with parallel bars and wheelchairs and other things, which, again, can be very nice for a child to have a doll that's like them, or for an older sibling to have a doll that's like their new baby brother or sister. And there are also a number of videos and books that are designed to help kids talk about this and also to help introduce to other children how to understand a child's difference and talk about it in a positive way. But really everybody is different in one way or another. And having a difference with a limb really shouldn't hold you back. They can really do anything they want to do.
Dr. Suskauer, thank you for taking the time to answer some questions for us about the Limb Differences Clinic at Kennedy Krieger Institute. For those of you who are looking for more information about the clinic, visit www.kennedykrieger.org or call Kennedy Krieger at 443-923-9200.